Some of the studies are showing that dental assistants have some of the lowest job satisfaction rates in dentistry. Why do you think that might be the case?
Lack of support in a lot of areas. I really try and get them involved in the why behind the what so that they're invested in it. That's the basis of creating a safety program. You know, you can't hold people to a standard if you don't tell them what they're supposed to be doing.
Monica Satake is the leading voice when it comes to helping offices create a culture of safety. With over 3 decades of clinical experience, an expert in OSHA compliance, and is the founder of True North Training and Consulting, which has helped thousands of dental professionals take their infection control practices to the next level.
How would you advise an up-and-coming dental assistant? How do they find community and resources that are gonna help them be really successful?
Well, let's start off with how the doctor can support that.
Monica, why is your work as a consultant so important to not only the function, but the health of a practice?
Well, I'd like to speak at it from a dental assistant perspective and also from a consultant perspective. So I've been in the field for over 30 years and recently took a position back in a hospital-based dental clinic so that I could stay relevant and current with things. And so the reason why it's so important is not just for patient health, but also employee health, and in making sure that when we're treating patients with all aspects of infection control, and some of it melds over into OSHA with worker safety, that we understand what we're doing.
Yeah. Speaking specifically to your expertise as a dental assistant, you've been a dental assistant, you said, for how many years?
I'm going on 35 years.
35 years. So you've had a tremendous amount of experience and insights. I would love for you to share some of the things that you've learned along the way.
Well, so I was an educator in a formal dental assisting program, CODA accredited for a lot of years, 12 to 15 years. And so what I would see specifically in my home state of Idaho is across the nation, there are different regulations for dental assisting education.
Yeah.
And in my home state of Idaho, there's no requirement for formal education. And so the Idaho state law does require, though, that there's training for site-specific protocols. So, for instance, before someone can assist with nitrous oxide or administer nitrous oxide, they would have to have formal training by the dentist. Or to take radiographs, they would have to have formal training by the dentist. Also, when we're talking infection control, there's got to be training with bloodborne pathogens and hazard communications before any employee starts doing those at-risk duties. And so with a formal background, depending upon the program, like the program that I taught at, it's a CODA requirement that they have approximately 30 hours of infection control before they even go out.
Gotcha. Okay.
But if someone doesn't have a formal education, they're on-the-job trained and they're required to know those things that they've never had any training on and to provide those tasks to the patient, which puts them in a tough position because they don't know why they're doing those things.
Right, yeah.
So I would say lack of consistent education across the board is one of the biggest challenges.
And it's so cool that I'm speaking to you specifically about this because you're a massive proponent of education in that and that shows even in your experience. I mean, education has been such a consistent thread for you across the board. Would love to dive into that deeper. Why is that? It seems like a silly question, but when you look at reality, there is a lack of education. Why is education so important? And specifically, why is it so important for the dental assistant?
So I'd like to give a little personal story if I could.
Please do.
So, I had gone through the CODA accredited program that I taught in myself back in the early 90s and had been working for quite a few years and understood quite a bit about infection control and OSHA stuff, but I don't think it became exponentially clear to me until my husband had a heart transplant. And when I started learning about like the immunosuppressants and immunocompromised situations that would put them at risk for a basic dental visit.
Yeah.
And I mean, we're here at the ProEdge headquarters, and so aerosol generating procedures, if the water lines aren't treated, could cause a fatal situation for someone who's immunocompromised. But let's just say not everybody knows somebody that's had an organ transplant, but I bet everybody knows someone that has had cancer or is going through cancer therapy and is possibly immunocompromised. So outside of the patient portion of that, what about the workers who are working over those patients with the aerosol generating procedures who might have an immunocompromised situation? So that is why it became so important to me. And I use those stories quite a bit when I'm out doing education. And pictures of folks that are in my own personal journey that I think about when I'm providing those tasks or I'm completing those tasks during the workday, because I want them to understand why they're doing it.
Yeah. I want to hang out there a little bit too. The why is such an important piece to just the day-to-day grind of making sure things are staying up to date and getting things done. How have you experienced that? How have you been able to educate on that? Because it does help give purpose to what you do. I think that's so important.
So a lot of what I do is in-office hands-on training. I think people have different learning styles, and a lot of folks that are in the dental field, they learn with hands-on or scenarios, workshop type of settings. And so oftentimes I'll go in and I'll cover what we're doing with infection control. So for instance, I'll talk about maybe surface disinfection and talk about why do you think it is that we have to spray or wipe discard wipe, and do you understand the reason for letting it set that long? And then I will grab their specific disinfection and I'll just ask, hey, can you raise your hand if you know how long you're supposed to be leaving this on the surface wet? And sometimes they all know and sometimes they don't all know. And that's super important. And so I really try and get them involved in the why behind the what so that they're invested in it.
It does cultivate like ownership.
It's
like I want to, now that I understand the deeper meaning, I want to be a part of this, which is so cool. The flip side of that is also reality, and not necessarily a detachment of ownership, but just the feeling of going through the day-to-day motions, and it's like, what kind of impact am I having? Is this really like meaningful? And we've seen historically, but even today, some of the studies are showing that dental assistants have some of the lowest job satisfaction rates in dentistry. From your experience, why do you think that might be the case?
Lack of support in a lot of areas. Number one would be if they're the one that is trying to promote certain things in the practice, that maybe it's a new guideline. And we've never done it that way is a big thing that we try and jump over that hurdle a lot. And that's something that I hear all the time, even with my training, when I go in and do these trainings, I'll hear oftentimes people say, well, we've never done it that way before. And so I usually give the source, and then talk to them about how we can overcome the hurdle of staying stuck. And so that mindset, also lack of knowing where to get help. I find that most dental assistants and most teams really want to do the right thing. They really do. But finding someone to answer questions. So for example, I often say, hey, have you ever had to go onto the OSHA website and try and find an answer to something? And the answer across the board usually is, sometimes we don't have enough time in our day to do that.
Right.
And so a lot of I think the frustration from a dental assisting perspective is, once they even find the resources or figure out what they're supposed to be doing, finding the time in their day to implement those things. It's overwhelming a lot of times. And getting everyone on board and cultivating a culture where everybody wants to do that.
Yeah, that's huge.
Yeah.
Let's take each of those. So the support one I think is massive, right? It's like you're absolutely right. We hear that all the time with waterlines of being like, I went to this webinar or I heard from Monica that I need to be doing this thing. And it's like, well, we've never done it that way. How have you advised people in that situation to work with their team to understand that this is actually really important?
Yeah, well, from a consulting perspective, oftentimes if I have an assistant that calls me up and says, we would really like to have a third person come in and do this because I've been trying to do this and it's not working. And I know that not everyone can do that, but I will kind of assess the behavior before I go in to figure out how to encourage them to do it a different way.
Yeah. Oh, interesting.
Yeah.
That's such a cool perspective. Yeah, saying I need somebody else. I need that third person, that third source to come in because this isn't working, and I need help, which gets directly into support.
Yep.
How have you in your own experience, when you're coming into something that's like either new or you don't know, gone towards finding support, and then how would you advise maybe an up and coming dental assistant that's taking on the whole world? It feels like. And there's all these things that are new to them. How do they find community and resources that are going to help them be really successful?
Well, let's start off with how the doctor can support that. Because it's going to all depend on the doctor supporting.
Yep, love that.
Most hygienists that I have experienced are on board with it because obviously hygienists have to go to school to have their licensing. But dental assistants don't necessarily. Now, some dental assistants have gone to a formal school.
Sure.
And so most hygienists are on board with this kind of thing. And so then, I usually break it into chunks, honestly, because it's easier to digest. And so when I go in and do a training, I will usually I'll take resources with me. So guidelines on like the CDC guideline that is the summary is a good place to start for someone that has no idea where to begin. It does have checklists in it, but and that's good, but I want people to get beyond the checklist of things because it goes much deeper than that. And so I usually have them parse out when we're doing these trainings, I'll have them write down 5 things that they want to start with.
Cool.
And then, there's usually more than 5
I'm
starting with a new client. But I'll have them write down 5 things. And then after the training and before I leave, I'll actually have them pull up their staff meeting schedule.
Okay.
And I will have them prioritize the 5 things that they choose.
Yeah.
And then we work on the next 5 things. And so at that time, and I'll usually follow up with an email if they want resources. I'll give them links to resources, and so I work closely with whomever is in charge of infection control to provide resources. But it's kind of like coaching.
Sure.
You do the plays, and then you go and review the plays on Saturday morning first thing, and then you come back and you do a little bit more to better it. And so that's the goal in all of this is I try and provide, and my method of consulting is that I try and provide support for the assistants well after we do the training. And then the goal would be to get them kind of on a recall so that I can come in and we can go, okay, these 5 things that you did last time, where are we at with this? Yeah. And then we add 5 more things to it. And so then we want to really get them to, I want to say a maintenance stage, but it's not ever like a stagnant thing. It's always, it's a living thing.
Totally.
And so my goal then would be to support the assistant, or a lot of times the hygienist is actually in charge of infection control too. And so I want to support them. And if I have SOPs that I've created, I'm not just creating those to keep them in my file folder. I want to help them, and support them too. And so sometimes they don't even know what an SOP is. But that's the basis of creating a safety program. You can't hold people to a standard if you don't tell them what they're supposed to be doing.
Yeah. I really love the 5 items in that it helps create focus. And then it shows, I think, how to win in some regards, right? It's like when there's so much stuff on the table to have to navigate and do.
Yep.
It's so nice to be like, oh wait, let me just focus on these 5 and know how to win in these 5. And that feels really good when you actually are able to like start checking those things off. And you're like, oh, I put the SOP in place for this and we're doing it. We're following. Okay, on to the next thing. I feel like that really improves morale. You mentioned something really interesting with the hygienist oftentimes being kind of in that, I guess maybe we would say infection control coordinator role. So, and I want to talk about that in a little bit. And then maybe the dental assistants carrying out a lot of those responsibilities and tasks. From your perspective, what have you seen be really effective? Is it that dynamic? Is it, we say all the time that the infection control coordinator role is like this person that's just, they're the ones over infection control and you delegate that to the dental assistant and then they feel like they have that type of role or responsibility. But from your perspective, how have you seen that dynamic work really well in regards to who gets infection control and actually manages it?
Well, usually it's the dentist delegating that. And
totally.
sometimes it's the hygienist picking it up because they are passionate about it as well. But you have to have a point person. We talk about infection control and we talk about OSHA, but again, those two things overlap a lot. And so if you were to have somebody come in and do an OSHA investigation, you have to have a point person for that, or it's chaos.
Totally.
And so it's got to be a collaborative effort. Communication is going to be key because, again, you want everyone to have skin in the game. And so, this seems kind of archaic, but I'm a big fan of putting butcher paper up on the wall in the staff break room.
Yeah.
And writing down, like, who's in charge of what.
Yeah, totally.
Dates that are, the item is due. And if it's not due on that date, maybe, what's the challenge with this getting it done? And maybe we put it down on the list of priorities if we have to follow through with something else.
Yeah.
Having a visual and having follow through and just consistent communication is key.
Yeah. Let's dive into that more too, because I think you're absolutely right. I like the skin in the game comments so good in that when you do have from the dentist to the assistant, everyone in between, when they're all bought in, one, the culture looks way different.
Yeah.
But two, I think in regards to safety specifically, that also is way different when everyone's feeling like not only are they taking ownership of safety, but they're contributing to the role that safety plays in the office. What are some powerful tools or advice that you've given to help an office that may feel maybe a little disconnected because of just the business of their day to come back, reconnect, feel cohesive, feel aligned, and both in their communication and then directing that towards safety?
Yeah. Well, I think it's really important, again, to have those staff meetings or morning huddles, both, actually.
Yeah.
Because if staff meetings are only once a month, you kind of forget maybe, but morning huddles and just kind of touch base and see where everyone's at. Not everybody has a lot of time in the morning to do a morning huddle. But again, everyone taking ownership of that. And then just remembering that this is a service industry. We are here to serve our patients and making sure that we keep that in the forefront. And I think that goes a long way with patient safety. I think in the staff meetings, not just always, well, here's the task that we have to do. Becomes kind of burdensome when it's just that's always the focus. But I think we want to celebrate, like you said before, the successes.
Yeah.
How did we accomplish this? What worked and what didn't? And always being open to maybe not criticism, but constructive feedback.
Yeah, totally.
Because you want to keep it positive. And, as the person in charge of infection control and OSHA, just being open to that feedback and saying, hey, here's why this isn't working. And maybe could I give some input about what might, because, we've got a lot of talented people in our offices and stuff. Yeah. And I don't have talent in some of those areas, and I'm going to put people in place that I can look to who excel in those places. And that, I really encourage my clients to do that because you want people to feel valued and feel like they're heard.
I think, giving somebody responsibility and ownership like that, there's so much more buy-in, and you're right. I think that improves satisfaction. You're right. They feel heard. They feel like they're being brought into a place where they can operate in their strengths and their gifting. And that's so huge. going back a little bit with just the busyness of, right, because you're like, sometimes, it's hard to set aside time. There's just so much to do.
Mm-hmm.
And we would often, we say the phrase, right, it's important to work on the business, not just in the business,
Mm-hmm.
which is like, this is working on the business. Your team coming together
Mm-hmm.
is super important. When that doesn't happen and you're just trying to get through the day because it's so busy, how would you advise against burnout? I feel like with dental assistants, that's a real reality.
Mm-hmm.
There's so much on the plate to do that burnout feels inevitable.
Mm-hmm. I think networking is huge. Hosting things hosting little get-togethers, and I don't know how realistic this is for everyone, but I find that even for me as a consultant, having a network of other consultants to talk to about things, and hosting. I encourage people to do continuing ed. That's a big one.
Yeah.
Because most of the time you're going to find other people there that are walking through the same stuff that you're walking through. And truly you're looking for people to bounce ideas off of, to see what's worked in their offices or what hasn't worked in their offices. You don't have to reinvent the wheel.
Yeah.
And people are eager to share those things. And so somehow getting, we have a local dental assisting page, and oftentimes people will on Facebook.
Yeah.
And so people will oftentimes bounce ideas off of each other. And so I think that's really important to have that, because if they're new to this and they don't know where to turn, having colleagues to turn to. And again, with education, I think there are plenty of free CEs out there.
Yeah.
And there really is no excuse for not continuing education with the amount of CEs that are out there.
Yeah.
And so oftentimes, like even in webinars and the chats or whatever, people are exchanging contact information so that they can ask questions later. Last year, Kelly T and I, we did SOPs for some stuff.
Awesome.
And I still have people contacting us to get SOPs, because the goal, we had them for all sorts of different brands. And the goal in creating those was to have people use them when they're building their safety stuff. So start somewhere and then build on it and supplement things.
Yeah. Well, and to your point, it's like, you don't have to reconstruct the wheel. You just did so much of the heavy lifting.
Right.
It's like now people can benefit from the expertise that you've had there. And so I think what you just said hit home on a couple of things. One, it's a huge resource. Having people that you can be in community with that have either gone ahead of you and have something that they can share, or just wrestle through a current reality or challenge. And then two, which I think is huge, is not feeling alone. Oh my goodness. Yeah. It's how easy is it to feel alone or isolated in doing all of these things that you've never been trained to do, and really no one in the office really knows what to do. And so you're just left to kind of figure it out.
Right.
Which I think leads to burnout. I think it leads to really this cycle of coming in, high hopes, really excited, and then just the constant having to learn and be challenged and not having resources must feel so isolating. To that degree, how can the office, and maybe we'll come back and bring a few things that we've already talked about, but how can the dentist and a hygienist and even the industry at large, manufacturers or even DSOs, empower and encourage the dental assistant in what they are doing? Because what they're doing is so important.
Well, I think a big one is oftentimes when they go in with those high hopes and they're maybe shot down for whatever reason. They don't have the resources. Maybe the culture isn't one where they're encouraging growth. It leads to insecurity, which also leads to the burnout. And so if they can feel more secure in what they're talking about, that is really helpful. So again, with just taking educational courses, but also I've been a certified dental assistant for all of those years. And then I also hold the CDIPC, so certified in dental infection and prevention and control. And each of those things has given a method of accountability because you have to keep your continuing education units up to be recertified every year.
Yeah.
And, whether that comes with like a promotion or a raise, it's personal development and it's personal satisfaction.
Totally. Yeah.
And it's also going to be beneficial to the practice too, because the things that you learn along the way in those certifications and the courses can only benefit the practice. And I would always encourage the practice owner to, they're held to a high standard. And so if you have a dental assistant or a dental hygienist that's wanting to promote those things and put those things into place, support them in that.
Yeah.
Start building the safety program from somewhere. There are prepackaged safety programs, but you have to supplement them according to your site and your state standards.
Yep.
But the satisfaction comes from continuing to learn, understanding that it's a living document, and getting everyone on board with the tasks, but also taking ownership of those things in the dental office and seeing patients.
Yeah, you started going down this path, so I want to take it, which is you've done multiple things to professionally develop your own expertise as a dental assistant, and we've talked a lot about how the industry can support the dental assistant in ways to resource and be a community. How can the dental assistant be the best dental assistant they can possibly be? Like, what does, as they look into the future of this career, what does it look like to walk that line so well?
Was this on the list of questions?
No, this is spontaneous and awesome.
Just understanding that, again, it's not a list of checking the boxes and stuff, and looking at the bigger picture of patient care and personal satisfaction. Maybe they're not going to also always be a chairside assistant. I had no idea when I was a chairside assistant when I first graduated from my program that I would go back and be an educator. And I started with teaching expanded functions in the early 90s. And so I would go into offices and teach expanded functions. And then I started working in 2007 full-time at the school where I attended. And so I had no idea that I was going to be an educator that way. And then, I would have students that would graduate from the program, and I would always say, keep your notes, because once your office finds out that you're proficient in this area, you're going to become the infection control coordinator. And oftentimes I would get a phone call from a student that graduated that said, guess what? I didn't keep it, and I'm the infection control coordinator. And so that became a big part of why I became a consultant, is because I wanted to walk alongside these students, number one, and walk alongside the offices, and then just continue to coach them and mentor them and stuff, because they're trying hard to do it. And so looking at the big picture and understanding that there's more to this than just what's right in front of you.
Yeah.
There's a purpose for what you're doing.
Totally. Yeah, I love that. I think dental assistants more uniquely than anyone else in the office, or I think it's just unique in what they're able to do. I think obviously the dentist and the hygienist contribute to this, but we often use the word a culture of safety. And I think the dental assistant has a very unique way that they can contribute to that. From your perspective, what is a culture of safety, and how can an office cultivate that?
Well, again, it's communication and allowing, maybe delegating some things so that everybody has a part in it. Yeah. So again, that it's not resting on one person's shoulders, but understanding that the goal in all of it is to keep the patients and the staff safe, because we want people to have a long career. Yeah. And if they are exposed to something that's career ending, that's a real bummer. And so I think it kind of goes back to what we talked about in the beginning of helping people understand the why of what they're doing, but also pulling people along or asking them to come along in it, and seeing where they can contribute to it so that the outcome is good.
Yeah, yeah. We know that dental assistants are often overwhelmed with everything they have on their plate. How have you seen dental assistants use technology or leverage resources to make their life easier?
Mm-hmm.
Yeah.
So oftentimes when I'm done doing an in-house training, I will have them pull up their staff meeting schedule, and I will have them take their 5 things that they want to address, and plop a topic into each of those staff meetings. So let's talk dental unit water lines.
Yeah.
So I love the automated processes that ProEdge has. And so oftentimes I will just pull up the website and give them tools to, because sometimes they're just really insecure about how to even start that process.
And
so coaching them on, okay, well, let's actually bring in your product to the next staff meeting. And I won't likely be at this next staff meeting, but I'll just give them tools to start holding meetings. And so I want them to bring in their product that they use and start with the basics. What do the IFUs say? It's possible that they're not being used correctly even. So once you get past that, then I really love the educational portion of the website and ProEdge. I've used it for years. But specifically, if you don't know what to talk about during those meetings, pull up a ProEdge YouTube video and show it. They're just short little videos that you can use in your staff meeting. Have a Q&A session. Doesn't have to be long. Have a Q&A session after that. Print off resources. Plug them into your dental lab or in your sterilization area to be reminders. So in essence, it's kind of a checklist. But then I will also take them and help them navigate the website while I'm there. And I really want people to get signed up on the ProEdge dashboard, specifically Clear. And because what that does is it sends out reminders for their testing. It gives them an opportunity. It's a log. So you have defensible documentation, which is a requirement in a lot of states, but it's also good for your own records. And even if you're using the in-office like QuickPass, you can also log that. And you get to interact with the customer delight team here. And did I mention they are really a delight? They're
awesome.
And so this gives them, I feel like this is a really good confidence builder to begin with. And then I always let them have an opportunity to follow up with me. The nice thing about that dashboard is that it sends out the reminders for testing. That gives me an opportunity when if I can get permission from them to sign up, as their consultant. It also sends me a reminder, and it gives me an opportunity to have a touch point throughout the year. When I can call them up or email them and say, hey, are you good with this? Do you need more product? Do you have any questions? And so that keeps me in the loop, and it builds trust.
I love that. And I want to talk about that just a little bit, that dynamic, that relationship between the office staff and you, the coach consultant, and some of the benefits that really come from that relationship in terms of managing frustrations, managing focus, managing time, managing the to-do list, and give you an opportunity to kind of talk a little bit about your own expertise and how that plays into the office. So tell me a little bit about that relationship and why that's such a beautiful thing to potentially look at wanting for your own office.
So I recall an office that I first started working with that I actually was introduced to when I had students going there for clinical site visits. And so I was in a different role then, and my role was just to watch my students in their clinical sites to make sure they were doing what they were supposed to be doing. But oftentimes when I would go in for clinical site visits, the staff members would ask questions, and I was happy to, it's education. It doesn't matter who it is. So later on, when I started my own consulting business, they contacted me and asked me to come in and start working with them. And so I believe this is year 4 that we've been working together. And at the very beginning, the person that was in charge of infection control was pretty overwhelmed when we got done with the first training. And I just kept reminding her, hey, I'm here for you. We're going to break this into chunks, and we're going to start with, again, the 5 things. And so this last year, I was just in a couple weeks ago doing their training, and I'm so proud. It's like a proud mom moment.
Yeah, totally.
Because I get to go in, and it's organized, it's clear. It's continually growing. We're always adding supplemental things, but I'm also always trying to find different strategies to help them not have to spend so much time on it.
Yeah.
Because she does have other duties too.
Yeah, totally.
But I'm so proud. And just a quick email after training to say, I am so proud of you for how far you guys have come.
Yeah.
I want you to make sure that you focus on that part of it. And even though there were things that we're still working on, and that we, had a list of things after this last meeting, take a look at how far you've come. And that was really encouraging to her.
Yeah. One of the final questions that I have for you is, what advice, and you might be pulling from different parts of this conversation that we've already talked about and just kind of summating here, but what advice would you give to a dental assistant today that's getting into this line of work?
I would say don't give up. Sometimes it can be overwhelming. And again, it comes from, like, if they're coming from different backgrounds, they may have a concept of what they're getting into. And then those that maybe, because sometimes people get hired, and this is a legitimate reason, but they'll get hired based on their personality. If they have a personality that is good for patient care, that they can interact with patients and stuff like that, they'll get hired based on their customer service skills and that kind of thing, because there's a huge portion of that. We want our patients to feel safe. And I would say, I've talked to my consulting friends about like marketing your infection control.
Yeah. Oh,
and patients are smart, and they ask questions, and so being prepared to answer those questions. But I would say, as a new hire, maybe somebody that's fresh out of dental assisting school, seek out someone with experience. Find continuing ed classes. Don't wait for somebody to assign it to you. Be proactive about your education. Yeah. You'll be highly sought after if you do that. And maybe if you didn't do it, but it should be something that you're just aspiring to do.
Yeah. Oh, so much words of wisdom right there. I love it. Thank you, Monica, so much for being on the podcast.
It was my pleasure. Thank you, Andrew.